Okay, hi there. My name's Gail. I'm a nurse. I'm currently working for the Foreign and Commonwealth Office, where we're dealing with the COVID response and rolling out a lot of vaccines. As part of my job, I have to deal frequently with Public Health England and many other scientists. So what can you expect in the terms of side effects? Well, at the moment, and of course we're still collecting data as we go along, it's looking like about 70% of people get no side effects at all, which is really good. 30% of people are, and the side effects seem to be pretty evenly split between the Pfizer vaccine and the AstraZeneca vaccine. These are the two vaccines we've got at the moment. What we have seen, though, which is interesting, is that if you've ever had COVID-19, the disease, even if it was way back at the beginning of the pandemic, so over a year ago, you are a bit more likely to get side effects, and we think that may be as high as 50% chance of getting side effects. What we can say is that with the second dose, particularly of the AstraZeneca vaccine, the risk of side effects is much, much lower than it is with the first dose. And what are the side effects? Well, by far the most common side effect is a sore arm. So that, it seems to be very common, but that is also very common for any vaccine you have. The second most common problem that people have been reporting is that they develop a fever. Their temperature goes up a few hours later or the next day, and that tends to cause sort of aching, so your bones and joints ache a bit. And again, that seems to be fairly common if you're going to get side effects. It lasts, if you're lucky, for most people, less than a day. If you're really unlucky, it might last a day or two. And the third most common side effect is a bit of gastrointestinal disturbance. So you might feel nauseous or get a bit of diarrhea. And again, that seems to settle within a day or two after the vaccines. If you get the aching, sort of feeling really achy and shivery type symptoms, you can take paracetamol. That's perfectly safe. It won't stop the vaccine working. And we prefer that to ibuprofen or aspirin, which may technically just make your vaccine work not quite as effectively. So paracetamol, good. And that's absolutely fine to take it if you get any aches or pains after your vaccine. If you find that any of your symptoms are not settling, so if they're not settling after a few days, or if they're getting worse, then it's always sensible just to get it checked out by your doctor. But as far as we can tell, most people, it settles pretty quickly. The other thing just to remember is that getting side effects makes no difference to how well you respond to the vaccine. So if you're one of the lucky ones who gets no side effects at all, your vaccine will work just as effectively as people who do get side effects, because it's different parts of your immune system that are working when we have the side effects. But we've measured antibody levels in lots of people who've had the vaccine, and there has been absolutely no difference to the antibody levels in people who've had side effects and the people who haven't. So I'm afraid it is a bit of luck of the draw with the old side effects. But overall, if you are unlucky, particularly if it was the AstraZeneca vaccine, just be reassured that all our evidence so far shows the second dose is far less likely to make you feel poorly.